Hello, everyone. My name is Professor Michael Boateng. I teach mathematics and statistics at Delaware County Community College. I present to you the topic, the dynamic behavior of macrophages in wound healing. And more specifically, I'll be talking about the mathematics underlining the inflammatory phase during wound healing. Now, the motivation for this research at a personal level was to have a real and hand-on experience with mathematics application in biological science. Now, let me make this point here. When I was doing my first degree in math, I had the opportunity to take a lot of courses in physics and in chemistry. So I knew right away where math was applied in physics and in chemistry. But I did not take a lot of classes in biological science or in biology. So I had no idea where math could be applied in biological science or in biology. So when I was doing my master's level, I decided to challenge myself to see how and where mathematics is applied in biological science or in biology. So at a personal level, that is the motivation factor for this research topic. And again, I decided to work on wound healing or look at wound because I read a lot of research work in biological science, and wound healing was the area that decided to work on because it has a very huge socioeconomic problems, because we have quite a number of people in the US alone who battle with chronic wound. And to give you some little statistics here, about 6.5 million adults are affected by chronic wounds just in the United States. And in terms of money, the wound care cost projection for all wound ranges from 28.1 to $96.8 billion. So as you can see, it has a very huge impact on individuals and the society at large. So these are the motivation that, pushed me to research into this topic. So now let's get into the introduction. So somebody may ask, what is wound? Now, basically, or at a basic level, wound in a normal skin is an injury that occurs when the protective barrier between the outermost layer, which is called the epidermis, and the innermost layer, or the deeper layer, which is called the dermis, is broken. So anytime you get a cut and you see blood coming out, what has happened is that the outermost layer and the innermost layer, the barrier between them is broken. All right. And when that happens, wound healing begins right away. All right. And we have two main types of wound. We have acute wound and then chronic wound. All right. And this is based on how the wound progresses from one phase to the other phase. So for acute wound, if the wound heals with no complication in a predicted amount of time, then we say that that type of wound is acute. But if the wound is stuck in one or more phases of the wound healing process, then we have a chronic wound. So it takes a very long time for this type of wound to heal. So here, wound healing is a natural process. Okay, the body is built to heal itself. And it's a very complex process because the human body, as we all know, is a very complex thing. All right. So, like I mentioned, we have phases of wound healing, and it is taught that wound healing progresses through 4 phases. The first phase is called the hemostasis. The second phase is called the inflammation phase. The third phase is the proliferation phase. And then the last one is the remodeling phase. So I want to take my time to explain the main things that happens at these phases. So let's look at the homeostasis phase. So at this phase, let me break it down here, okay? And let me give this disclaimer here. I am not an expert in biological science. Now, when I decided to do this research, I spoke to my supervisor about this topic, wound healing. And then with my supervisor, we went to the biological science department at Youngstown State University. And we spoke to the dean. So the dean was a consultant in biological science. So all the consultation was done in the office of the dean of biological science department. So all this information was verified and certified by the dean of the biological science department. Like I said, I have limited knowledge in biology or biological science. So when I was doing this research, I did a lot of reading, okay? So this information here about biological science was certified and was verified by the biological science department at Youngstown State University. So I want to make that point clear here. Okay. So the hemostasis phase, these are the 3 main things that happen. So anytime you get a cut, naturally what happens is that the blood vessels that are broken shrink in size. And the purpose here is to avoid a lot of blood lost, okay? To avoid a lot of blood lost. So the blood vessels shrink to allow less blood to be lost. And then the second thing that happens is that there's a formation of platelet plug, all right? Now the blood that streams into the wound carries platelets, okay? And these are very small, colorless, disc-shaped cells, all right? And they form a plug, okay, around where the vessel is broken to prevent blood from oozing out. And the third thing that happens is blood clotting, okay? The blood becomes thicker to reduce the rate at which the blood flows. So the main thing that happens here is that the body stops itself from losing a lot of blood. And these are the mechanisms that it uses to do that, all right? And then right after this phase, the wound healing process moved to the inflammatory phase, okay? And the inflammatory phase, here, the inflammation brings more blood, which contains white blood cells, okay, to the wound site. And we have 2 main types of cells that come into the wound site at this stage or at this phase. The first one is called the neutrophils, okay? These guys are cells that consume dead things or bacteria at the wound site, because if your body is open, bacteria get into your body and you have dead tissues and you have broken vessels. So these cells come in to clean up, all right? They come in to clean up anything that is not wanted at the wound site, okay? And this happens, within 24 to 30 hours after injury, okay? And we have specific signs that are associated with the inflammatory phase of the wound healing. And the first one is you see some redness around the area, and then there's swelling around the area, and of course there's pain because of the migration of the cells to the wound site. So these are the three things or the signs that are associated with inflammatory phase. So anytime you get a cut or you get a wound and you see some redness or you see swelling or pain, remember that, hey, the wound process is at this phase, the inflammatory phase. All right. Now let's continue. So continue with the inflammatory phase here. The second type of cell that migrate to the wound side is called the monocytes, okay? These are also white blood cells. And these monocytes are attracted into the wound site by this growth factor here, the transforming growth factor beta, okay? Which is produced by platelets. These are chemicals, and these chemicals, they signal these type of cells. And when they come, these cells differentiate into macrophages. Now, the meaning of this here is that they change, okay? They kind of mature into another type of cell in the presence of some chemicals. All right, and these macrophages are essential in wound healing, okay? Because they are involved in the formation of new blood vessels, the covering of the wound, and the matrix deposition. We also have chemicals or growth factors like the TGF beta, the tumor necrosis factor, which is the TNF, and then we have the IL-10, the interleukin-10. They are very important chemicals during the inflammatory phase of the wound healing because they serve as molecules that signal cells and also stimulate the proliferation of the various macrophages. Okay, so this is exactly what happens at this phase, all right? And then after this phase, the wound healing moves to the next phase, which is the proliferation phase of wound healing. And this phase lasts for about 2 weeks, and it consists of this type of cell, the fibroblast, okay? These fibroblasts, they migrate into the wound site, okay? And the main purpose of these cells is they come to build up things, okay? They come and they come to build new tissues, okay? New connective tissues, and tiny blood vessels are formed, all right, in the surface of the wound, all right? So that is what happens at this phase of the wound healing. And don't forget, the main type of cell at this phase is the fibroblast, all right? And the main type of chemical that is very important at this phase is the platelet-derived growth factor here, the PDGF, because these chemicals, they attract these cells, okay? So these cells, they come to build the broken vessels, connective tissues, all right, which helps the wound to heal. And they also produce collagens, which is the major component, the extracellular matrix. So that is what happens at this phase. And then we move on to the wound moves on to the last phase, which is the remodeling phase, all right? So here, the remodeling phase, the tensile strength of the wound increases from 20% to 80%. And here, the most important growth factor that regulate this process are we have the PDGF, the TGF beta, and the fibroblast growth factor, right? These are the chemicals that control and regulate these phase. Okay, yeah. So we have that phase. Yeah. So let me summarize this whole thing for you. Okay. Let me give you this picture here. So the picture that you are seeing here is someone with an injury. All right. So here you get an injury here, you get a cut, the barrier between the innermost and the outermost part of the skin is broken. We have blood coming out. So the reaction of the body is to stop this blood from coming out. Okay. So here we have clot formation, and this phase is called the hemostasis phase. So when that is done, this is kind of done within the first 2 hours of the time that the injury occurs, all right? And then it moves on to the inflammatory phase of the wound healing, okay? And at this phase, we have these type of cells, the neutrophils and the monocytes, which differentiate into macrophages, all right? And then we have chemicals that attract these type of cells into this wound site. So these guys, these neutrophils, they come to consume bacteria, dead tissues, dead cells, kind of clean up, right? So I want you to look at this whole process as, this whole wound process as a collapse of a building. When a building is collapsed, the first thing that the building engineers do is they go in and they stop water and gas leakage, okay? So that would be this phase. And then after that, we have the demo guys who go in to clean. They go and demo, clean everything that is unwanted, right? That is the job for these guys. So these guys are demo guys, kind of. And then the next phase is we have the builders who come in to build whatever is damaged, all right? And here we have macrophages and then the fibroblast cells which build up things, okay? And then the last phase, in terms of the collapse of the building, we have designers and people who decorate rooms and building. They go in and do the finishing touches, make the place beautiful and nice, all right? And here we have the remodeling, and that can take about 1 to 2 years for this to happen, all right? So this is the picture of the 4 phases of wound healing. Now, as you saw from the topic of the my research, the mathematical model that I'm going to build is on the inflammatory phase of wound healing. So I want to summarize all the activities that goes on in the inflammatory phase of wound healing. First of all, we have these type of cells, the neutrophils. These are pro-inflammatory cells, okay? And they consume things, okay? So here, these type of cells, they come in, they eat up bacteria, they eat up dead cells, they eat up like clot, blood, everything that is not wanted at the wound site. They come in, they do that, and they leave. And then we have the monocytes, okay? These are white blood cells that come in, and they are being attracted into the wound site by this chemical, okay? This chemical here, the transforming growth factor beta. And when they come, they differentiate into macrophages, all right? And the growth factors, very important at this phase of the wound healing, are these chemicals, the TGF beta, the TNF, and then the IL-10, okay? Growth factors, very, very important. And now, of course, the focus of this study will be on macrophages population behavior, and then the macrophages phenotypes, M1, M2, and MR, and how they influence the inflammatory phase of the wound healing process. So these type of macrophages, okay, this information was given to me by the biological science of Youngstown State University. Okay, they gave me that information that these type of cells, when they come in, they differentiate into M1, M2, and then MR. Now, these M1 macrophages, according to the expert in biological science, they are more of consuming cells. They come in to consume tissues, dead cells. They are kind of demo guys, right? They come in to clean up. And then these two guys, the M2 and the MR, they are repair macrophages, okay? They regulate the wound healing process, or they repair broken vessels, they repair broken tissues. So these type of macrophages are very, very useful, okay, for the progression of the wound healing process. Okay, so I want us to understand that. Now, so this is a summary of what happens in the inflammatory phase of the wound healing. Now, moving on, based on the publication by Peter J. Morey and Thomas A. Wynn, I came up with this flow chart. This flow chart here is the simplified version of whatever goes on in the, excuse me, guys. Yeah, whatever goes on in the inflammatory phase of the wound healing process. All right. So here, I'm just focusing on the inflammatory phase. So I have this chemical, okay, the transforming growth factor here, beta, in the wound. These are chemicals. And these chemicals attract monocytes. These are white blood cells, okay? They attract them from the blood vessels. They come into the wound site. Now, according to the expert, biological science expert, these cells, in the presence of this chemical, the interferon gamma, these cells differentiate into this type of macrophage or macrophages, M1 macrophages. And then in the presence of this chemical, the interleukin-4, interleukin-13, these are all chemicals, right? These monocytes differentiate into MR and then M2 macrophages, okay? Now let's focus on these M1 macrophages for a second. Now these M1 macrophages, according to biological science expert, they produce TNF growth factors, right? This is a tumor necrosis growth factor here. They produce that, and then these chemicals also stimulate, meaning they attract, okay, M1 macrophages. So this guy produces that. This guy also stimulates this M1 macrophages. Now for the MR macrophages, which are the repair macrophages, now they produce the interleukin-10 macrophages, and these chemicals inhibit, or they kill, or they prevent the M1 macrophages. And then the M2 macrophages here, right? Now, they also produce the TGF-beta, which attracts the monocyte into the wound site. That chemical, this M2 also produces that chemical, all right? So it's kind of, this produces that, and then we have more of this, And then in the presence of this chemical, we have more of M2 macrophages. So as you can see, this is a complex process, okay? And even this is a simplified version of whatever happens at the inflammatory phase of wound healing. Now, so based on this flow chart, and the reason why I did this flow chart is because I wanted to see in simple terms what is going on in the inflammatory phase. And this is going to help me build or write the mathematical model for the inflammatory phase of the wound healing. So based on this flow chart, right, I came up with this mathematical model equations. Okay, so let me explain what this equation is all about. So the M1 macrophages, we know that the monocytes come into the wound site, all right? And then in the presence of the TGF, which this is the TGF, okay, I shortened that. So this is the monocyte. In the presence of the TGF, we have a proportion. So this number here, this is a parameter here, okay? This is a proportion of the monocyte changing to M1 in the presence of this chemical. And then this M1 produces the TNF, the tumor necrosis growth factor here, right? And that also stimulates the M1 macrophages. That's why this is a plus. This guy produces that, and this guy attracts that. So here we have this parameter here giving you the proportion of that is attracted into the wound site. And then here we have the interleukin, which is produced by the M2 macrophages, and that inhibits the M1. Okay, they kill them or they prevent them, right? So we have this proportion that are being inhibited by the interleukin 10 growth factor here. And then this factor here is, of course, the cells naturally die, right? So we have this D1 as the proportion of M1 that naturally dies. So that is the explanation of the plus and minus in this equation here. I mean, if you've not taken probably differential equations, maybe this equation does not make sense to you. But if you've taken a course in differential equation, I think you can make a little bit of sense from this. All right. Yeah. And this term here is the rate of change of the density of the M1 macrophages. Okay. So this is it's a function of time. The M1 macrophage is a function of time. You go at times move on the increase in density. And then for the M2, this is the rate of change of the density of the M1 macrophages. This is the proportion of the monocyte that differentiate into this type of macrophage, right? And then this M2 produces the TGF growth factor. And then we have this proportion that also stimulate the M2 macrophages. And then this is the natural death of the M2 macrophages. And then we have the MR macrophages. This is the rate of change of the density of the repair macrophages MR. We have this proportion of the monocyte differentiating into this type of cell. And then we have natural death of this type of cell. And then for the chemicals, right, the growth factors. So for the tumor necrosis growth factor, the TNF, this is the differential equation for that, okay? This chemical is produced by the M1. So we have this proportion produced by the M1. And of course, these chemicals, you know, they just die out naturally. There's a natural death, all right? And then transforming growth factor, okay, beta, is produced by the M2. So we have this proportion of the this chemical produced by M2, and of course, they dry out naturally, okay? Then we have the interleukin 10 produced by the MR, this proportion, and then naturally they just die out. So I came out with these 6 differential equations. And this is the mathematical model that we're going to use to understand whatever is going on in the inflammatory phase of wound healing. So putting all together, I have these differential equations. And these differential equations, I solve these equations using ordinary differential equation solver in MATLAB. Okay, this is a software. So I use a software to solve these equations numerically. All right. And these are the graphs that I got. Now, let me explain this. So, first of all, I made this assumption that equal amount of monocytes differentiate into M1 macrophages, M2 macrophages, and then MR macrophages. So here I'm choosing 1/3 for alpha, 1/3 for beta, 1/3 for gamma. And if you want to see where I have alpha, beta, gamma in the equation, let's go back. Let's go back into the equation here. So this is alpha, proportion of monocyte differentiating into M1. This is beta, proportion of monocyte differentiating into M2. This is gamma, proportion of monocyte differentiating into what? MR. So I decided that, hey, let's look at what's going on if equal amount of monocyte differentiate into M1, M2, M3, all right? And see what comes out. So this is the graph I got. This is the numerical solution. Now, this is for M1, right? Macrophage. The vertical axis here is the density, okay? The density of this type of cell. And then here, these are the days, okay? This is the time in days. So what's going on here is that, look, so this is day 0. So let's say day 1, these cells increase a little bit, and then they decrease steadily, all right? So as you can see, there's day 10, we have very low levels of M1 macrophages. And don't forget, the M1 macrophages are very destructive. They come in and they eat up anything that is in their way. So they eat up dead tissue, they eat up bacteria. They can also eat up good tissues, all right, and good cells too, okay? So the quicker these guys come in and leave, the better for the wound to heal. Because if these guys linger in the wound site for a very long time, they will end up creating more damage to the wound site because they'll end up eating things that they're not supposed to be eating, all right? So, and then we have the M2. This M2 and MR macrophages are very useful in the proliferation phase of the wound healing. So the longer they stay, the better for the wound healing process because they are repair macrophages, okay? They help repair broken vessels and broken tissues, all right? So as you can see, I'm using day 10 here. So core amount of the monocyte differentiating to M1, M2, MR macrophages. The wound is progressing to the next phase. So here we can see that the wound is healing because it's moving from this phase, the inflammatory phase, to the next phase, which is what? The proliferation phase of the wound healing. And then in terms of the chemicals, you know, this TNF, day 10, Again, we have low factors, right? These chemicals, they stimulate this. So if we have low of these chemicals at the wound site, means that we have very few M1 macrophages coming to the wound site, which is a good thing. And then we have the TGF. The TGF, they are chemicals that attract monocytes. But as you can see, this is flat. I think for day 2, it's flat. It's back to 0. So, which means that we don't have a lot of monocyte coming to the wound site. And then this chemical here, the IL, the interleukin 10, day 10, see, we have low levels, which means that because this chemical here inhibits this macrophage. So if we have some amount of this chemical in there, it's good, so that any damaging cells at the wound side can be taken care of by this chemical, right? So this is case 1. This is one scenario. And I also look at this scenario here, that what if we have 50% of the monocyte, okay, migrating into M1, and then we have 25% and 25% differentiating into M2 and MR macrophage. Now, as you can see, the 10, this is decreasing, all right, but the 10, we still have quite a number of M1 macrophage at the wound site, all right? And then this guy too, we have still some of them at the wound site, but we have more of these cells, okay? These cells are very destructive. They come in to consume. So what this tells us is that even though these guys are decreasing in numbers, it's taking a longer time. It's taking a longer time for these guys to get out from the wound site, which means that the wound is going to be stored a little bit at the inflammatory phase. So even though the wound is kind of healing, but it's taking a longer time for these cells to leave the wound site, okay? Yeah, because these guys, they come to eat up, and they can create a lot of damage if they linger in the wound for a very long time. All right, so that is the takeaway here, right? And this is the case that we look at. 50%, we have more of these cells than these two guys, all right? Yeah. And then moving on to the next scenario that I looked at, I said, okay, what if we have 50%, okay, differentiated into M1, and then 30% differentiating into MR, and then 20% differentiated into the MR macrophage. And look at this. See, this guy is increasing without bound. Okay, so for this case, and then look at this chemical here. This chemical here is also increasing without bound, because this guy produces that, and this guy stimulates that. Okay, so this situation, the wound is kind of stuck at the inflammatory phase. So here we can say the wound is not going to heal. It's not healing, because this type of macrophage are still there. The demo guys are still there, creating a lot of damage to the building, all right? Yes. So even though these guys are still there, but if these guys don't leave, the wound is not going to progress, all right? So that is the takeaway here. So if we have imbalance at this level, we have 50% for the M1, and then we have different amount of M2 and MY macrophages according to this mathematical model the wound is stored or stuck at the inflammatory phase of the wound healing. Now, I looked at the last case, okay? Now, the last case here is that I said, okay, what if we have very little, like 2% of the monocyte differentiating into M1 macrophages, and then we have 90% differentiating into M2 macrophages, and then we have 8% differentiating into what? The MR macrophages. What happened to the wound at the inflammatory phase? And here, as you can see, this is day 10, right? But look, we still have quite a number of M1 macrophages in the wound site. And day 10, we have MR. But as we progress, like day 20, day 25, we have low levels of what? This M1 macrophages. And day 20 here, we have low levels of this chemical, which attract the M1 macrophages. So for this case, we can say that, hey, the wound is healing, but it's taking longer to heal, okay? It takes a longer process. It takes a longer time to progress from the inflammatory phase to the next phase of the wound healing. All right. Now, in conclusion, okay, now summarizing all the numerical solutions. One, I say that the numerical solutions indicate that wound progresses through the inflammatory phase successfully if approximately equal amount of monocytes differentiate into M1, M2, and MR macrophages in the wound. Second, wound may progress through the inflammatory phase if there is an imbalance between the pro-inflammatory macrophages, which is the M1 macrophages, and then repair or the regulatory macrophages, provided there is enough MR macrophages in the wound. However, this may take a longer time, okay? I think we saw that from the graph. And 3, the numerical result also indicate that MR macrophages play a key role in the inflammatory phase of wound healing. And since MR macrophages produce the interleukin-10, the IL-10, there must be significant level of IL-10 concentration in the wound to ensure that the M1 macrophages decrease to low levels in the wound. The leaving of the M1 macrophages from the wound is a very good sign that the wound is progressing through the inflammatory phase successfully. Now, 4, since monocytes differentiate into M2 and MR macrophages in the presence of interleukin-4 and 13, for normal healing to occur, there has to be enough interleukin-4 and 13 in the wound to ensure more M2, M1 macrophages in the wound to promote wound repair. So this is the conclusion of this whole research. And I thank you for your time. And if you're interested to read the whole thesis, I am more than happy to send you the link or a PDF copy of the thesis for you to enjoy and read, okay? Of course, I summarize the whole thing. There's a whole lot, okay? So if you want to learn more about this wound healing process and the mathematical model and everything that I did for my thesis, you can send me an email at Boateng1, this is 1 at dccc.edu, and then I'm more than glad to send you the link. Thank you for your time.